I'm Dr. Lisa Bagnall from We Teach Nursing. I'm going to talk to you about the second step of the nursing process, and that is the nursing diagnosis. Let me pull you over to my screen here. Diagnosis is a critical step because it links the assessment to everything else that follows. The diagnosis and treatment of human response to actual potential health problems is a definition from the American Nursing Association for nursing diagnoses. So what's the difference between a medical diagnosis and a nursing diagnosis? Well, medical diagnosis describes a disease or illness or injury. A nursing diagnosis is a statement of a health problem that the nurse identifies, prevents, or treats independently, written in terms of the human response, and it's a clinical judgment about the individual, family, or community experiences or responses to actual or potential health problems or life processes. Now, nursing diagnoses are used to treat health problems independently or in collaboration. Collaborative problems require both medical and independent nursing interventions to prevent them or minimize the complications, whereas an independent nursing problem is something that the nurse can treat on their own without any other professional. There are different types of nursing diagnoses. One is the actual, it's what exists. Risk for potential, risk for something happening. For example, risk for fall related to an unsteady gait. Possible diagnoses exist when your intuition and experience direct you to suspect that a diagnosis is present, but you don't have enough data to support the diagnoses. Wellness diagnoses is used when an individual, group, or community is in transition from one level of wellness to a higher level of wellness. Two conditions must be present to make a wellness diagnosis. Number one, the client's present level of wellness is effective, and number two, the client wants to move to a higher level of wellness. You want to analyze and interpret the data that you gather from your assessment to identify the problems. You want to cluster those cues into categories. You want to identify data gaps and inconsistencies, draw conclusions about the health status, make inferences, identify problem etiologies, and verify the problems with the patient or client. So a cluster, let's go back to this. Let's go back to the beginning. Significant data are data that influence your conclusions. A cue should alert you to look for other cues that might be related. A cluster is a group of cues that are related to one another in some way, and they suggest a health problem. They help to ensure accuracy. You want to identify data gaps and inconsistencies. As you cluster and think about relationships among the cues, you will need to identify the need for the data that were not apparent before and also look for inconsistencies. You want to draw conclusions about the health status as well as the strengths as well as problems. Inferences, this is a critical thinking step and skill. And you recall the cues that are facts or data, whereas inferences are conclusions or judgments that are based on the data. One of the things that you will be doing throughout nursing school is you want to place the problems in order of importance. So what is going to kill the patient first? What is the highest problem? You want to identify the problems, their etiologies, whether they're situational, they're treatment related, pathophysiological, spiritual, and so forth. You also want to verify these problems with the patient. After you identify them, you want to know where they're from, if possible, what the origin of the problem is. And then the diagnostic statement is the interpretation of that data, and the patient's interpretations may differ from yours. So there's ways to prioritize the problems. It doesn't mean you have to resolve one problem before attending to another. It means that the highest priority problem gets attention first. So let's say a patient comes in with an acute exacerbation of COPD, and let's say they just, I don't know, they're in pain, chronic pain from arthritis. And let's say they're not able to, I don't know, walk around as much as they should be able to. The first priority problem would be respiratory, because that would be something that would cause clinical decline first above all others. So respiratory insufficiency, impaired gas exchange, ineffective airway clearance would be the highest priorities. And when you think of Maslow's hierarchy of needs, breathing comes far above psychological or love and belonging, self-esteem, and so forth. So you look at the order of priority when you formulate your care plan. Writing a nursing diagnosis, I'm going to talk to you about that in just a minute. The nursing diagnosis suggests a desired outcome or goal. Related factors, etiology is a cause, and defining characteristics as evidenced by. This is a three-part nursing statement. What we require in our college is two-part. Risk for falls related to what? Postoperative confusion or an imbalanced gait, and so forth. And we were going to learn this together in the lab.